This one's kind of interesting. It was a device that is intended to measure blood pressure, and the company was claiming that it was a general wellness product, and the FDA sent them a warning letter saying that it has an inherent use or an inherent intended use that is associated with the diagnostics of hypo or hypertension, and so therefore they considered it for use in the diagnosis of a disease or a condition. So, one thing that's interesting about that warning letter is that, we are all familiar with the intended use and indications for use, but now the FDA has this unspoken inherent use to consider, and that these can wrap up materials or features like antimicrobial coatings, soy filters, or claims including like this warning letter, the blood pressure monitoring for wellness purposes. And so the FDA says inherent use is where public knowledge can imply a use to a medical device or a monitoring.
Yeah, this is something that we are starting to see more and more of, especially out of COVID. I saw a lot of this where they were like, you're adding these components that have, properties, even though you're not making any statements about them, people will assume that they have a function. And so you need to address it in your submission. We saw a lot of that coming out of COVID and Whoop blood pressure is kind of this warning letter kind of followed that trend. Here's what Whoop had to say. They said FDA is out of its gourd, basically, and that, they were misguided, they were under general wellness. It was actually quite
Yeah, they threw the gauntlet
strongly,
down.
it was quite strongly worded. Um, and after that, after the Whoop warning letter, Apple actually got clearance
Just
for
shortly thereafter.
Yeah, for a hypertension blood pressure feature in their Apple Watch. So Whoop was issued a warning letter. Whoop is arguing with FDA. Apple gets a clearance. And
Which
then,
factors into why like that Whoop likely got the warning letter in the first place is because FDA knew that this was coming down the pipes, and they're like, well, we already are regulating this underneath the 510(k), therefore they should that the what am I trying to say, Ty?
well, what happened was they had
That Whoop, like, okay, we just cleared this underneath a 510(k), and then so therefore Whoop is illegally marketed because
well,
we have hypertension.
well, if you look at Apple's clearance, they had submitted in February, and then they were probably doing the back and forth with FDA to talk about it. And then Whoop got issued their warning letter right between these. So they got issued their warning letter in July. So FDA, when they were doing their review, was probably either pointed in that direction or was doing their own organic research to kind of determine which way they wanted to go with this feature, saw Whoop and they said, well, if I'm going to clear a 510(k) for this feature, why wouldn't I also market the same device under those same scrutiny? I mean, it kind of makes sense, but there's a little bit of reading between the lines and where there could have been some espionage, there could have been some finger pointing, who really knows? So the wellness guidance. The wellness guidance has been around for a long time. This is what it says. It's about enforcement discretion for general wellness products that are intended to help, support a healthy lifestyle or help living well with a disease is basically the two categories. So either it's completely health and wellness, or if it acknowledges some sort of disease or condition, it's only to kind of live well with. And these are the big exclusions. It doesn't identify or name diseases. It doesn't put out characteristics as abnormal, pathologic, or diagnostics. This January, just a couple weeks ago, FDA actually updated this guidance document, and it now explicitly has a blood pressure example in it.